Mr. Majewski's Anatomy 32 class lecture, Chapter 6, Part 2, Bone Surface Markings and Histology. So, there are a number of different categories of bone surface markings, and the first big category are going to be depressions and openings. So, a good example of this is a fissure, which you can see in the picture of the sphenoid bone there, and it is a narrow slit between adjacent bones, and it is a place where blood vessels and nerves can pass through the bone. So the example here is the superior orbital fissure. You'd find that in the skull. Foramen. A foramen is just an opening in the bone. Usually it's small and sort of circular, and it allows blood vessels, nerves, or ligaments to pass through. So again, in the sphenoid bone, you see the foramen rotundum. Fossa. A fossa is a shallow depression. So you see two fossas here on this image of the distal end of the humerus, the radial fossa and the coronoid fossa. A sulcus, on the other hand, is a furrow along bone surfaces, or sort of a groove, and it's where blood vessels, nerves, or tendons could lie. So here on the proximal end of the humerus, you see the intertubercular sulcus, which sometimes is referred to actually as a groove. And there's the meatus. The meatus is a kind of large tube-like opening. The best example is in the temporal bone, which is the external auditory meatus, which is basically where our ear canal is. Then you have processes that form joints. So these are coming together with other bones to make a joint, and therefore they're usually smooth, because after all, we don't want any friction at a joint. So first example is a condyle, which is a large round knob. It has a smooth articular surface, and it's at the end of bones. So here at the distal end of the humerus, you have the medial condyle and the lateral condyle. You can also have a facet, which is a smooth, flat, or slightly curved articular surface. A good example of that is the vertebrae. Here's a vertebrae with looking down on its anterior surface, and you can see the smooth facet there. Head. A head is usually a rounded articular projection, and it is usually supported by a neck of bone. So the neck will be rough because it's not actually forming the joint, and the head will be smooth. Then you have the processes that form attachment points for connective tissue, like ligaments and tendons. And these tend to be rough because that increases surface area to make a more powerful or stronger attachment. So one example is the crest, which is a prominent ridge or elongated projection. And again, it is roughened. So here we see on the ilium, which is part of the pelvis, and the iliac crest. Epicondyle. That is a roughened projection above a condyle. Epi, above. So again, on the humerus's distal end, we see that you have a medial epicondyle and a lateral epicondyle, just superior to the two medial and lateral condyles. A line. A line is a long, narrow ridge or border. It's rough, and being a line, it's usually much smaller and less noticeable than a crest. And so here we see on the proximal end of a femur the intertrochanteric line. Spinous process. Spinous process is a sharp, slender projection. So, for instance, basically when you feel your backbone and you feel those lumps of your vertebrae, that is the spinous process of each vertebrae. And it's roughened. Rough, rough, rough. A trochanter is a very large projection. Again, it's also rough because this is a site of attachment. So here at the proximal end of the femur, you see the greater trochanter. And then there's the tubercle, which is the variably sized rounded projection that's also rough. Now I know you're going to ask, well, how do you tell the difference between a trochanter and a tubercle? Well, that's a great question. My advice is you just have to learn which one's which. And so in this picture of the proximal end of a humerus, you see that there are actually two tubercles. You have the greater tubercle and the lesser tubercle, and in between them is that intertubercular sulcus. Oh, yeah, names start to make a little sense. And then finally there's the tuberosity, which is a rough, bumpy, variable-sized projection. Often it's not very large in that it sticks out a lot, but it can be very wide, so it could cover a lot of surface. Histology of bone tissue. Well, bone tissue is a type of connective tissue. That means it has a lot of extracellular matrix, and within that matrix are cells. Now, in our bone tissue, there are four main types of bone cells. You have the osteogenic cells. These are basically bone stem cells that can differentiate into osteoblasts. Now, osteoblasts are very important because they help form the bone's extracellular matrix and help deposit the calcium and phosphate and so forth. And eventually, the osteoblast will differentiate into an osteocyte. The osteocyte is a bone cell that helps maintain the bone tissue. And then you also have the osteoclasts. So if we got the osteoblasts building up the bone tissue, well, we don't want our bones to get too huge, so then you have the osteoclasts who function in resorption, or basically breaking down the bone extracellular matrix, releasing the calcium and phosphate. Now, osteoclasts are unique in the bone for bone cells because it actually comes from a white blood cell lineage rather than from a bone cell lineage. So what about that extracellular matrix? Well, its chemical composition shows that it's about 30% organic components. That would be primarily the collagen fibers. Collagen fibers very big in bone, and also the ground substance. And this provides it with flexibility and tensile strength. Then 55% of the extracellular matrix is inorganic components. These are the minerals, the calcium, the phosphate that are in the form of hydroxyapatite, and this provides the hardness of the bone. And then of course there's water. About 15% of it's water. So bone deposition is a term used for when osteoblasts build up the organic components of the bone, putting down the ground substance and the collagen fibers, thereby giving a place for it to then trap the calcium ions and the phosphate ions. And when it does this, it actually is reducing the amount of calcium ions and phosphate ions found in the blood or in the plasma. Then bone resorption is when the osteoclasts cleave, see, clasts cleave, the organic components, breaking it up and thereby releasing the calcium ions and the phosphates into the bloodstream. So here is a picture of the tissue of a bone. So you see that it has got a lot of ring structures repeating throughout it, and each individual ring structure is referred to as an osteon, also known as the Haversian system. And within the osteum, you've got the central canal, which has the blood vessels and the nerves. And then you have a number of lacunae, or individually a lacuna, which is basically a cavity. And within that cavity is where the osteocyte lives. And then the lacunae are connected to the central canal by canaliculi. And they're just basically canals that let the transfer of nutrients and the elimination of waste to occur. And each of those rings of this ring structure is referred to as a lamellae. And here's another image. You see the osteon with its lamellae. You've got the concentric lamellae found in the osteon. You also have an outer circumferential lamellae, which goes all the way around the outside of the bone, and an inner circumferential lamellae going around the inside of the bone. And then you also find in between the various awkward portions where the circular structures don't actually exist are what are called interstitial lamellae. And they are basically left over from previous osteons, and they just fill in the extra space, thereby keeping the compact bone compact. Spongy bone is different from compact bone in that it has lots of open spaces within it. And those structures of the bone part are referred to as trabeculae. And they are similar in that they have the lacuna, they have lamellae, they have the caniculi, the caniculi, but they lack any central canals. They don't have an osteon structure. So you got the spongy bone with the trabeculae, you've got the various types of lamellae, and then on the very outside you have the periosteum, which has an outer fibrous layer and an inner osteogenic layer. And running along the periosteum are the periosteal veins and arteries that can then enter into the compact bone through perforating canals that allow them access to form these blood vessels in the central canal and provide nutrients for the bone. You also have, coming from the periosteum, is the perforating fibers, which help attach it firmly to the bone by actually having collagen fibers go into the compact bone. So, the bones are alive. They need blood in order to get nutrients and to get rid of wastes. Now, the largest blood vessels entering and leaving will enter or leave by the diaphysis in the nutrient foramen. So actually a long bone could have more than one foramen, but most of them usually have at least one. And that provides the blood for the bulk of the diaphysis. However, you also have a metaphyseal arteries and veins that can enter through perforating canals to provide blood for the metaphysis, and then the epiphysis has its own perforating canals that bring in the epiphyseal arteries and veins. And that is it for part 2 of this lecture series.